Hi, everyone. This is Dr. Ginger here. I am excited to share with you a new service from Garner Pelvic Health in conjunction with Rupa Labs called LabShop. And essentially, what this does is improve your access to labs. Now, a lot of people you might hear in the healthcare side of things, we'll start with the cons. Like, why would we want patients to have access to labs? They don't know what they need. They don't know what they're supposed to be, et cetera, et cetera. So you hear a lot of kind of don't research your own health. Don't leave the education up to us. Don't go get it directly. And so I think for those people who would naysay direct access to labs, I think that argument comes from a place of control. But when you look at the industry and how the industry disruption around lab service has improved access and lowered cost at the same time, it's hard to argue that this would be a negative thing. Now, could someone end up spending extra money on labs they didn't need? Absolutely. And that's where you need the guidance of a healthcare provider. So that's why this service is full of positives and there's not a whole lot of negatives that or risk involved in participating. So here's the service essentially. It's a partnership between what Rupa Labs offers and Garner Pelvic Health so that they can negotiate lower rates on labs for you on over like 30 plus different companies, I believe it is, so that they lower the price for you by negotiating those rates that are very, very reasonable. You'll see how when you look at the link that I'll share in just a second. But then it also empowers you to know, should I actually go get care for a particular condition? So if you have a high deductible, for example, I'm going to give you a kind of a classic example. You have a high deductible, you haven't had any basic blood work done lately, but you really, really want to get on, losing that weight that just you can't seem to peel off no matter what you do with your exercise and diet. Well, being board certified in lifestyle medicine is one of the ways that I help people to focus on that longevity, to improve longevity. So if you haven't had that lab work done and maybe you have a high deductible or getting in with your PCP, you're not quite meshing with, or they're not versed in the means by which you're asking for help, which is lose weight, get in shape, feel better, be there for your kids and your grandkids, be able to get on the floor and play with your kids and grandkids, or to go on vacation instead of being in a hospital getting testing done or procedures done because you have a chronic disease. That's what I'm talking about. So while your PCP may not be versed in integrative and lifestyle medicine, it is one of the ways in which I am certified and trained and in. And so that allows us to identify red flags, go to your PCP if necessary. But if it is things that we're able to handle from a lifestyle medicine, fitness, cardiovascular health, prevention of diabetes, or management of that through diet and exercise, lifestyle medicine, those are things that we can handle for you at a much, much lower cost. And sometimes an incredibly low cost through other membership options that we have through Garner Pelvic Health, that it saves you time and money, and that money gets to stay in your wallet so you can spend it on a vacation instead of on healthcare. So I think that's one example, a case where you may have not had that basic work done and you're not sure how to start that exercise program. Well, that's where we can help. Right? So you would get that basic blood work done. And of course, in the way the program works, if there's any issues, they would be flagged and identified for appropriate referral so that you can get the care you need if and when you need it. And so that empowers you in a preventive way so that you don't have to wait until something goes wrong. You don't have to wait until you have chest pain. You don't have to wait until your hemoglobin A1C is all of a sudden off the chart and puts you in pre-diabetic, position. Because the thing is also, you could end up visiting your practitioner, your primary care practitioner, and if insurance won't pay for preventive care, you could be pre-diabetic in that pre-diabetic phase, and you would be told your labs are normal because technically they're normal, because insurance is not going to pay for the preventive care to get you out of the pre-diabetic range. Again, that's where lifestyle medicine makes a difference. That's where we can come in and go, okay, if you're pre-diabetic, according to the lab, here's what we know works in lifestyle medicine. And that's what's so exciting about having direct access to these labs. So if you do them, and they're very low cost and they come back normal and you'll be told, right, that they're normal, then you can rest easier, right? You know that maybe you don't need services at Garner Pelvic Health, and maybe you can go on to start that walking program that you wanted to start, because those labs do come back normal. Now let's go to the other end of the spectrum. Let's say you're postpartum or you're perimenopausal or menopausal, and you're wondering, do I need any kind of hormone replacement? Do I need integrative or lifestyle medicine or pelvic PT in order to prevent leakage, in order to prevent genitourinary syndrome of postpartum or menopause? Well, that's again where there's no risk and it's very low cost for you to be able to directly access these labs through the new LabShop, and then be able to decide for yourself, well, I think it's a good idea. I think I need to go to get some pelvic PT. And again, we also do integrative and lifestyle medicine. We do functional medicine, which is a part of what all of this is, to be able to provide you the empowerment to say, I know what my labs say, and I know what I'm supposed to do with that information. And then you can go on to make an empowered choice in what you do with your healthcare, which again puts that money back in your pocket. It stays in your pocket instead of you spending it on a bunch of things that you may have not needed at all. So I am going to share my screen for just a second. Hang with me. And hopefully now you can see a Garner Pelvic Health lab shop. So let's go through just a moment, what that means. Now, the labs that may be offered, of course, will change over time. If Rupa drops a certain contract with a company, a lab may become unavailable, or they may add one that's more cost effective and more efficient at what we need to measure. And so those will change with time. But some of the labs here that we've put together basically just to offer potential or existing patients or clients here at GPH the ability to be in charge of their healthcare so that you can improve your access to care you need. You can not pursue care that you may not have needed. And along the way, we'll be here to guide you with the options that are available to you. And as always, the whole reason that we're doing this is to offer the lowest cost care possible. Because for too long, far too many of us, myself included, have overpaid for care that was unnecessary, that you didn't either need to be tested for, or that was grossly inflated because of what gets charged inside of bigger systems. And now we have the industry disruption companies that are actually doing a great job to, again, lower cost for you and give you direct access. So some of the ones that can be ordered are something like the basic menopause bundle, which keeps costs lower. And it covers a range of things that you can just click on the link and determine. Now, the Dutch test, I won't get into the huge details of. Its strength is not in measuring levels of hormones. And so that's where you'll hear a lot of misinformation from Instagram influencers or healthcare providers even, who will say, the Dutch is a completely worthless test. Well, this isn't the forum for taking on that argument right now, but there's misinformation that exists because it's not meant to actually measure those levels. It's meant to look at what your body does with them via metabolism. And of course, as we age, it's a huge concern for many people, because especially women, because they end up putting weight on around the middle, this visceral fat, and they're wondering how and why. I didn't change my diet. I didn't change my exercise. Or they're feeling like they're having a really rough postpartum or menopause experience, or they're having injuries. They're getting injuries, musculoskeletal injuries, or bladder or bowel leakage, and it came out of nowhere. Well, this actually helps us to treat those things, to tamp those things down, and to prevent them from happening to begin with, all based on how the body uses those hormones through metabolism, and also cortisol, which is super important to the stress response, especially in use of integrative medicine to treat it if we find out that you're struggling with that stress response. So I'll leave that highly contentious subject and move on to the next topic, which is a basic blood work bundle, a basic hormone and gut bundle. Again, putting together the lowest cost labs possible that will measure the bare bones basics to give you the information that you need to then help you make a decision. And you might say, well, how do I make a decision? Who do I talk to? Well, we do offer first consults free. Those are 10-minute calls where you could book your first free consult, get on the phone with me. It is a phone call and not a video call, and talk about that. You will get the results and recommendations from the physician authorization program that exists at Rupa. So you'll be well aware when things are in the red or when things are in the green. But you may want to know, what should I do with that next? Does that mean if I don't have a certain level of a certain variable that's being measured, does that mean I'm going to have bladder leakage? Does that mean my prolapse symptoms may be worse? What does that mean for my gluteal tendinopathy or tendinosis that I seem to keep getting all the time, every time I try to exercise? These help give us the answers to that so that we can actually fully explain those things to you and say, okay, well, here's how we would look at it from to our perspective in integrative physical therapy, for example. So you got basic hormone and gut, basic blood work, and basic hormone. These are the bare bones basics of what you could start with. And we have, again, tried to choose things that are the lowest cost but most effective possible so that we work with your existing healthcare team as a village, because it takes a village. No one practitioner, doctor, or therapist is going to be able to meet all of your needs. And you may not also realize that if you're a female going through postpartum or perimenopause or menopause, that functional, integrative, and lifestyle medicine based pelvic physical therapy and orthopedic physical therapy is a mainstay of navigating and recovering and getting the body that you want and the mind that you want. So the whole mind body complex, as you're traversing through everything from prenatal, postpartum, all the way to postmenopause. I think that's a hugely missed contingent and part of the program. Too many women will think, I'm going through menopause, I need to go see my GYN. Well, GYNs, as with all of us, don't receive any training in menopause unless they seek it out in addition to their training. So there are menopause literate professionals that you will find in physical therapy, mental health therapy. It's not just gynecology, urology, and some primary care physicians are also seeking out additional menopause training. Those are the practitioners that we want to be a part of your team. And that's part of what we will also help you do if you choose to do a free call. So, not to get into many huge details to make this more difficult than it needs to be, the whole point of the program is to make it easier for you. So, how it works is you order your labs on Rupa, and you can just follow along with me on the screen. You get those personalized instructions to complete your test at a lab location or at home. You complete your test, and then you get your results through Rupa. And there's also a nice FAQ at the end of the shop here that helps you determine, what about shipping? What about, the order? When does it get here? How long does it take, etc.? What kind of payment do you take? So I hope that when you visit this page, you can totally get a clear picture very quickly of the potential for what you can do to be able to get the information you need, learn how to track those labs for yourself, learn what they mean for you and how they can empower you with your whole body, mind, body complex health. And that is musculoskeletal health, top to bottom, because that's our focus at Garner Pelvic Health, is making sure that you get the answers you need and that we give you enough information that should your back pain, should that bowel bladder issue, whatever you're experiencing, should you start to feel more of that, I want to be able to empower you with the tools to know what to do next, right? So that if you have this symptom, you're doing these set of movements or exercises. Or if you have this symptom, you know that you might be missing a vital nutrient, which is all part of the lifestyle medicine and integrative medicine mission and focus. That is our goal. And that is certainly my passion for you. So more empowerment, less red tape, less hassle in getting appointments, easier access to the therapies that you need and the treatments that you need at the most reasonable cost possible. That's the goal that we have at Garner Pelvic Health and in our work with Rupa Health to be able to offer this lab shop. I hope this has been helpful. If you have any questions, just drop them in the comments below.